Hi, welcome to the 2020 Open Enrollment for Center for Children and Families. My name is Raymond Norton and I am with J. Wineland Group Benefits. We are the health insurance agents for your benefit program. The month of June is our annual open enrollment period. All elections will be effective July 1st and will remain in effect until June 30th, 2021, unless you have a qualifying event mid-year. Our medical, dental, and vision benefits will remain with Blue Cross Blue Shield of Louisiana, and our basic life, voluntary life, and short-term disability benefits will remain with Mutual of Omaha. We are also excited to roll out a medical bridge policy with Colonial Life. This policy will help cover some of your out-of-pocket costs if you're enrolled on the copay plan. Unfortunately, the bridge policy is not available if you are on the HSA or high deductible plan. Now, you will remember we have two medical plans for you to choose from. One of them is a $1,000 copay plan, and the second option is a $5,000 high deductible health plan. So let's get started by talking about the copay plan. This plan has a $1,000 deductible per person per calendar year, which runs January through December. After you meet your deductible, Blue Cross will pay 80% of the bill and you will pay 20% of the bill. That's called coinsurance. Now, once your coinsurance and your $1,000 deductible and all of your copays add up to that out-of-pocket maximum, which is $5,250 under this plan option, then Blue Cross is going to pay 100% of all of your eligible expenses for the remainder of that calendar year. Last year, that out-of-pocket maximum was set at $6,500 per person. So this is a significant reduction in your overall out-of-pocket exposure, and we were really excited to see that this year. Okay, now most of your day-to-day expenses, you don't have to worry about that deductible because you have copays. So if you get sick, you go to the doctor, you're going to have a $40 copay for your primary care doctors. That's your general practice, family practice, internal medicine, and pediatrician. If you see a specialist, an ear, nose, and throat doctor, an orthopedic doctor, a dermatologist, any doctor that has a specialty assigned to them, you will have a $55 copay. We also want to remind you that Blue Cross offers a Quality Blue primary copay for only $25. So when you see a primary care doctor that is designated as a Quality Blue doctor, you can see them for only $25. Now you can go online to bcbsla.com and click Find a Provider and search for providers in your area. If that provider is a primary care doctor and has a Q next to his or her name in a box, it's going to be a little symbol there. That's how you'll know that those are Quality Blue doctors for only $25. Now, this copay plan, it does not have a copay for your emergency room expenses. If you have to go to the emergency room, you're going to pay the first $1,000 of expenses, and then after that, Blue Cross is going to pay 80% of the bill, and you will pay 20%. So just be aware of that. High-tech imaging is also subject to your deductible. That's going to be, your MRIs or CAT scans, something that's a higher costing X-ray. Your lab and your low-tech imaging, those are going to be fully covered. You don't have to pay a copay or a deductible. So, if it's a simple X-ray or a simple lab, that's nice to know that you don't have to worry about any financial exposure on those expenses. Now, your preventative care, and this is true for both plan options, okay, so I'm going to go ahead and cover it now, but your preventative care, that's covered in full. You don't have to pay anything, no deductible, no copay. So when it's time to schedule your services, you call the doctor, you say, hey, this is for my wellness exam, this is for my preventative services, this is my annual checkup, and then that way they will code that claim to Blue Cross so that it gets paid in full, and again, that's under either plan option. So let's talk about the $5,000 high deductible health plan now. So this plan does not have any copays associated with it. You will pay all of your expenses up to that $5,000 deductible if you're enrolled with single coverage. So again, employee-only coverage, $5,000 deductible. Last year, that deductible was set at $6,000. So that's another improvement that we're able to offer you this year that we were excited about. Now, if you have yourself and at least one other dependent covered, it doesn't matter if it's a spouse or a child, or maybe your spouse and your kids, your family deductible is set at $9,000 for your entire family. Now, Blue Cross doesn't care how you meet that $9,000. Okay, it could be one person, it could be two people, it could be three people. Just until once that $9,000 is met, then it's met for your entire family, and everyone's expenses get paid for at 100% after that deductible's met. Now, what you have to be now the reason they do this, you're taking on more liability. You're having a higher deductible, so you're going to pay more of your expenses. They charge you a lower premium, and we're going to go over the payroll deductions here in a few slides. But just know that you're going to pay less with this plan option. So, if your payroll deductions are a bit of a concern to you and you want to save as much money as you can out of your paycheck, then take a look at that high deductible health plan. And if you have any questions on it, give me a call and we can talk about that in more detail. Now remember, both plan options offer telehealth services, and the recent environment that we've been under, where it's hard to, doctors weren't open or elective services weren't covered, many of you may have already started using telehealth services. This is a way for you to schedule an appointment with a primary care doctor 24 hours a day, 7 days a week, 365 days a year. Okay, all you have to do is download the Blue Care app on your phone or your tablet or your computer. Go ahead and register your information. You'll need your ID card handy for you to be able to create your account. But then once that's ready to go, okay, so if you get sick and you just you're not feeling well, or you want to have that telehealth visit, you can do that. There's no appointment necessary, and it's going to cost you no more than $39. So that's super affordable and super convenient. And from now until the end of the emergency period, any COVID-related services are covered at zero copay. So you don't pay anything if it's a COVID diagnosis. All others are going to be $39 or less. Now let's talk about prescription drugs, okay? You may not go to the doctor very often, but most people take a prescription drug here or there. Some of us take them, every month. And so the prescription drug benefits are with Blue Cross Blue Shield. They're administered by Express Scripts. And you have, depending on which plan that you're enrolled on, if you have the $1,000 PPO plan, your generic drugs are going to cost you a $15 copay, or up to $15. If it's less than that, then it's whatever the cost of the drug is. If you take a medication that's only $4, then you'll just pay the $4. Now, your preferred brands are going to be a $40 copay, and your non-preferred brands are a $70 copay. Well, what is the difference between those two? Okay, it works just like your in-network doctors with Blue Cross and your out-of-network doctors. Whenever you stay in their network, they charge you a better copay. You get better benefits for it. So if it's a preferred brand, it's going to be $40, and again, non-preferred is $70. So if you get to the pharmacy and they're charging you $70 or anything more than $40, really, you'll know that that's a non-preferred brand medication. And why don't you call your doctor and have a conversation with them and say, look, doc, the prescription that you put me on, it's not preferred with my insurance company. Here are the medications that they will cover. Can I try one of those? Now, this is completely up to you. Okay, we are not telling you that you have to do this. We're just saying that you do have choices that we want you to be aware of. And that is, changing to a $40 medication, because, we know that a generic won't always be available. Sometimes it's brand only, but there is a difference in the brand medication that you select. Okay. Now, on the high deductible health plan, remember we talked about everything goes toward that deductible. You don't have any copays at all. So once your deductible is met, whether you're a single person or family coverage, you're going to pay 100% of those costs. Once your deductible is met, then for generics, you're going to pay zero. Okay, you don't pay anything for generic after that deductible is met. But for any other medication, you're going to pay 20% until your overall out-of-pocket maximum is met. Now, is my drug covered, or how much does it cost? Those are great questions, especially if you're considering that high deductible health plan. We want to encourage you to download the Blue Cross Blue Shield app on your phone, so that way you can have the list of medications that are covered under your plan available and at your fingertips. So when you're at the doctor, you know exactly what medications would be covered. Another app that is great to use is GoodRx. That tells you what the retail costs are, retail, okay, not insurance, but retail costs in your area for every pharmacy in your zip code. So if you are taking ABC drug, and if it's a generic, you're responsible for 100% of that cost up to $15, or until your deductible's met if you're on that high deductible plan. And so what a lot of people don't realize is that not all pharmacies are the same. Even though you're covered with Blue Cross, every pharmacy has a different contract with Blue Cross. And so what could happen is if you're taking a medication, for example, my husband takes two generic medications, one's for his blood pressure and the other's for acid reflux, and they were both really affordable. They were less than $10. They were roughly in the $9 range for each one. And I always would go to Walgreens and pick those up because it's right around the corner from my house. And I was thinking one day, I need to download that GoodRx app, and so I did. And I found out that there's a pharmacy that I pass twice a day on my way to work and on my way home, and I could get that same medication for $6. Okay, so that's two medications. I'm saving $3 a month, $36 for each medication a year. It adds up. So I definitely changed pharmacies, and so now I'm saving money, and all because it was cheaper than what my copay cost. So just be aware that you do have choices and options out there in case you are interested in those. And here are our new payroll deductions for 2020. These will go into effect on your first payroll after July 1st. If you have the medical copay plan, PPO, these are going to be flat deductions now. Last year we were on an age banded rating structure, which means every single person had a different rate depending on what their age was. So they had a 21-year-old rate, a 22-year-old rate, a 23-year-old rate. Everyone had different rates. Well, now that we've moved into a 51 plus employee bracket with Blue Cross Blue Shield, they don't do the age banded rates anymore. They only do composite rating. Composite means you pay the same price regardless. If you're an employee only, you're going to pay $23.11 a paycheck for that medical plan, or $16.64 if you enroll on that high deductible health plan. So that is super affordable. Very little would come out of your paycheck each time. So those are the price differences between those two plans. If you want to cover your spouse, you see what the rate is, $254.20 if you're on the copay plan, or $183.04 for the high deductible. And then you can see the premiums for if you want to cover your kids or your entire family. So what do you need to do now? Well, like we said, it is open enrollment, so now's the time of year where you can add a dependent, drop a dependent, enroll in a plan, or change your medical plan. Hey, you decide you want to go on that high deductible plan this year, then this is the time of year for you to do that. All changes will go into effect July 1st, 2020. Okay. Now, if you are happy with your elections and you don't want to make any changes, you don't have to do anything at all. But if you would like to make a change, get the appropriate enrollment form, the Blue Cross enrollment form, and turn it in by June the 8th. We are also offering one-on-one Zoom sessions. So if you have an interest where you want to talk to me one-on-one, check out the Google Doc and schedule your appointment. And Melissa will be sending out an email with the meeting codes and passwords. Now here are the carrier connections. So if you have questions about your medical, dental, or vision plan, anything with Blue Cross, here's their contact information, and you will see those notes over there to the side that tells you which network your group participates in. So if you need to reach out to one of those carriers, here is their contact information. And finally, here's my contact information. If you have any questions at all, this is my direct dial number as well as my email address. So please feel free to reach out to me, and I'll be glad to help you however I can. We thank you for joining us today, and have a good afternoon.